I was going to make sure then that things that we were going to do the right way. Again, we're talking about kids. We don't mess around with kids. So, and that's really stayed true through the entire course of Blueberry. We so value the high-level evidence-based medicine that we follow. And then quality assurance checks along the way. And those are the pediatricians that we attract, and they truly believe in that mission as well.
Hi, everyone. Welcome to the channel. I wanted to introduce Dr. Lyndsey Garbi today. She is a board-certified pediatrician as well as a board-certified neonatologist and the co-founder and chief medical officer of Blueberry Pediatrics, which is a telemedicine company that allows you to access pediatric care from the comfort of your home. I'm interviewing her today all about the company, the mission, and how her and her founding team got started. So hopefully you find a lot of value in this interview, and thanks for watching. Welcome, Dr. Garbi. Thanks for being here.
Hi, thanks for having me.
Thanks for being here, and I just want to jump right in. So tell me what you were doing before Blueberry Pediatrics and what your journey was to Blueberry Pediatrics.
Yeah, sure. So as you said, I'm a board certified pediatrician, neonatologist, practicing in neonatology in an academic, large, high acuity center. I love that. I love practicing in person. I love being in critical care situations, and then assisting families when they're most in need and really quite vulnerable. The shift over really came when this opportunity presented, and it was a way to really reach more families and do good. And his personal growth was just an incredible way to kind of expand. You know, I'm sure most doctors, if there are doctors watching this, we study, head down, like one pathway, and all those amazing things about us when we were young kind of like just fall away. We don't hone those skills. So the creativity, I don't know, thinking outside coloring outside the lines, that all kind of goes away. So this was like the best opportunity I saw to build back those skills and have fun with them.
So what does Blueberry Pediatrics do?
Yeah, so we provide affordable, easy access to board certified pediatricians 24/7. So basically like putting a pediatrician in the pocket of every parent, which every parent deserves. If any parent knows, it's just scary. I mean, I'm a pediatrician and I get scared sometimes. Your kid has a fever in the middle of the night. You don't know what to do. You don't know who to call. Maybe you have an on-call pediatrician. Maybe it'll take them an hour to call you back. Maybe they won't call back. Do we need to give medicine? Do we need to wake them up? Can they stay sleeping? How hot can they be? There's just so many questions. And even if you know the answer to a lot of these, you just feel so alone, and you don't have to. You shouldn't have to. Kids they don't come with manuals. So we want to be able to provide that support, even if it's not for something so serious, like a real diagnosable illness. Things like, how do I deal with the nail growth of my baby? Do I cut them? What happens if I cut too low? Like the little things that parents should be able to have guidance for, and that pediatricians in office are unfortunately so limited on time that they can give for these things, and parents are embarrassed to ask or don't want to ask. So we enable them in that sense.
Yeah, I totally agree with that. I was in Iceland on a family vacation, and my son became really sick, really high fevers, 104, 105. I was freaking out. Luckily, as a physician, I have a lot of pediatricians who are friends of mine, and not everyone has that. And I was texting them nonstop about, okay, what do I do now? Okay, what do I do now? Do I need to book a flight home? You know, it just became such a very stressful time on what was supposed to be a very happy vacation. So love the mission, love the whole concept. Tell me a little bit more about how parents can access the care. Like, do they get some sort of kit where they can check temperatures, or are we assuming that most parents probably have a thermometer at home? Or what are the logistics of actually getting your child checked virtually?
Yeah, absolutely. So one differentiator about Blueberry and things that we believe in is treating the whole child and not leaving anything out. It's something that pediatrics focuses on greatly. So we want to make diagnoses and keep you home with your children. We want to do it the safest way possible. So that means getting as much of the information and with tools as possible. So we do send home a kit. You get an otoscope, pulse ox, and a thermometer, so we can have more data points in order to make assessments and then establish a plan with the family.
How hard is it, do you find, for parents to actually use these tools? Like, what is the process of walking them through that?
It's a great question. So it always depends on the age, the tolerance of the kid, the tolerance of the parent. We give a lot of guidance. Like they can watch our videos. Our customer support helps them through it tremendously. Having the customer support available is actually so important. So some parents do struggle. Let's be honest, it's like really hard to look in a 2-year, 3-year-old's ear. But if they get the image for us, which they do most of the time with our guidance and troubleshooting, they're going to go through that at the doctor's office probably as well. So they'll be able to do it from home, get a prescription, get a school note if they even need, and never have to leave.
Is it something that they can do when the child is sleeping, or is that
the ears are tough? Pulse ox, yes. Videos, we also are sent videos, photos, like a scrape, or like we want to see them breathing or coughing, just their overall appearance. So those things are pretty simple as long as they're distracted. Obviously if they're sitting watching TV, it's a good way to get in there. Ears are a little tougher, throats are a little tougher. Usually, we have all the guidance, 2 people, hold it, one holding, one navigating.
Yeah, I can understand that completely as someone who has 2 young children myself. So another question that I have is, what's the pricing like, right? So that's obviously a huge concern for so many people in this country. So what is the pricing like for Blueberry Pediatrics?
Yeah, so along with our mission to being able to offer this care is to make it affordable, like I said. So right now we're priced at $20 a month. So that's per family. So no matter how many kids in the family get this care and access to pediatricians 24/7, for that price, there's a one-time kit fee, and after that, and usually they can get it discounted or free with some of our offers. And then after that, 0 extra charges. That's it, $20 a month. And I mean, we probably, a lot of us spend more on like coffee. And then you can imagine co-pays if you go in for one visit, or if it's an ER, because a lot of parents do utilize ERs. We very much want to reduce ER utilizations that are unnecessary, urgent care visits that are unnecessary, and then navigate them back to their medical home, because it's just so important to keep kids within their medical home, which means back to their pediatrician.
So this question I have, because $20 seems really affordable, especially for the whole family. And if you have multiple children, you're really getting a deal here. How do you make money?
Yeah, so I am going to defer this question to my brilliant CEO, who is able to make those spreadsheets work, create the margins where it's functional. I can answer, however, overall, is that we are a tech-enabled platform. So the technology and engineering side, which is a key component to Blueberry, really enables us to do the doctoring in such an efficient way with no compromise on quality, that enables us to get to that price point.
Okay, and you don't take insurance because the price point is so low?
We don't take insurance for direct to consumer. However, we are in discussions with insurance companies in order to create partnerships.
So what happens if a child is truly ill and they need to be sent urgently somewhere? What's the kind of path for that? Do you just say go to your local ER? Do you guys have a network of doctors that you work with?
Yes, they're direct to consumer. We are going to navigate them towards their whatever is necessary at that point. I will say there's a lot of people who use our service from rural areas. I would love to give more information about that, because I think that's an area that we're helping tremendously. I was just looking up, I saw an article in JAMA that rural communities, about 58% of them don't have a pediatrician, which is wild. And then they have a component of like a completely rural, based on, I think, however they were stratifying it, 90% don't have a pediatrician local. We take calls that are, my options are, there's no pediatrician around, so we can drive 1 hour to a hospital where it's just adult trained doctors, or 3 hours to a pediatric emergency room. So it's really interesting playing field and way that, like, issues that we as telehealth providers are now helping to navigate. Figuring out the next best step for parents, I think, is as valuable as like saying, here, this is your diagnosis and here's your script. So a lot of parents don't know what to do next. So yes, we will refer them to the emergency room. If the emergency room requires a phone call from us, we will get that information and do it. We have a system of sending information to pediatricians because again, we very much want to navigate them back to the medical home. And we have a system set up within Blueberry where we can escalate through our team if we want to follow up directly and make sure they follow through, or if we were really concerned and wanted to know the outcome, we will actually give them a call, but the platform automatically will follow up. This is like the extra touch for those kids that we really do worry about.
Yeah, that makes total sense. I think rural care is a really big problem in this country, and driving obviously 3 hours to an emergency room for a basic exam when your child is sick, you're going to end up waiting there. It's a whole day process, and it's just not only opportunity cost, but your child is suffering and you can't treat them, and like a whole host of other problems that come along with that. I want to get a little bit back to the beginning of Blueberry and how the company was founded. So how did you meet your co-founder, CEO? What connected you guys, and how did you kind of embark on this journey together from both a financing perspective as well as a mission perspective?
Yeah, so we met through the co-founders had already known each other. And then when they decided to pivot into pediatrics, when they saw this hole in the market and a really big need that we could fulfill, they were wise enough to say, let's get a pediatrician on board, which I don't know that not all companies will bring in a doctor to be in the C level, which I give my co-founders a lot of credit for because we should be there and we need to make sure that we're there. So they brought me in and, it was a trial at the beginning. Like, is this a good match? Can I, like, A, do I have what it takes? B, do we like each other? C, do I want to make those sacrifices with my family and finances? And all I got going at home, 3 kids, it's a lot. It was a lot. But it worked. And we all loved it. We saw what we were doing was great, and we functioned well as a team, and we built from there.
And it was just the two of you to start, or was it more?
There were
4 people? So one person was taking the role of CEO, you were the chief medical officer, and the other 2 people.
So it's with us in the startup world, I think we just were all, there, like doing whatever job needed to be done with whatever title that really purpose, but they changed, they evolved over time as we raised rounds or had to really formalize things, and we took on the official titles. Like, I didn't take the chief medical officer title for a little while, but it eventually, yes, it all irons out actually quite obviously what the role should be and the title should be, but not from the beginning.
And I want to circle back on that one point, because I have seen so many companies in healthcare go under because they do not have a doctor involved in the C level. And anytime I go into a company for consulting and I say, you know what, who's making these decisions? Who's making these clinical decisions? Because let me tell you, these are not the problems in healthcare that people are going to pay for. And these are the problems in healthcare that people are going to pay for. And while we all have a mission around what we're trying to build, if no one's paying for it, it's not going to matter, because we cannot expand the mission. We cannot grow. So either insurance companies have to pay, or another stakeholder has to pay, or the patient has to pay, but someone has to finance whatever you're trying to build. And a lot of times only physicians who have the knowledge of what it's like to be on the ground treating patients and dealing with patients, and then also dealing with the back end of how healthcare works, really can understand the dynamic between the two. And if you don't have a clinician in the C-suite, it's going to be very, very hard to get to that next level. So I totally agree with what you're saying. Tell me about the financing. So how much did you raise in the beginning? Were you involved in any of that? And what was that like?
Yeah, the team was in the Y Combinator. I was not in that with them, so I don't even remember. Maybe I even knew at one point what the numbers were back then. I was not involved in the initial fundraising, but there was, there's money, but there's not a lot. So there's a lot of working for free. I mean, it's sweat equity, and then you get equity in the company. And you hope that it's the right decision and is successful. I mean, you still get a lot out of that professionally as you develop and go as it grows. It's like an MBA on the go for someone who has like an MD background.
Okay, so the initial funding round came from Y Combinator, and you had already met your co-founder CEO at that time. How did you guys connect? How were you introduced to him?
Yeah, so the one of the co-founders is a friend of mine from medical school, and he reached out and was like, "This is what we're doing. What do you think?" And the first phone call I remember was like them on the line and me being like, this is all the reasons you can't do it. It's gotta, like, I don't see how this can work. You got to take care of kids in the right way. I was like so adamant. And then they started to turn me around and be like, well, this is the issue that you're bringing up. We think with the tech, with our ideas, we can do it this way. How do you feel? And I'd be like slowly coming around being like, oh, well, maybe. And I actually think my suspicion and the way that I took a hard line on things was probably something that they actually valued, because I was going to make sure then that things that we were going to do the right way. Again, we're talking about kids. We don't mess around with kids. So and that's really stayed true through the entire course of Blueberry. We so value the high level evidence-based medicine that we follow. And then quality assurance checks along the way. And those are the pediatricians that we attract. And they truly believe in that mission as well, which is why I think they're so proud to work at Blueberry, why we have incoming inquiries to work for us. I just looked today. I think I could say on average, it's about 2 daily, because it's a mission that a lot of pediatricians really believe in.
Yeah, I think erring on the side of caution is definitely the way to go when it comes to telehealth, but it can be hard because as physicians, we're trained to base everything off of an evidence-based study. And, we're still kind of building that evidence with telemedicine. Like, okay, what's the lines of safety here? What can we do safely? What can we do effectively? And I experienced that also with ophthalmology when I was building my telemedicine app for contact lens renewal. And, it was always like being overly aggressive about how many things we needed to check and how many questions we needed to ask to do something that's fairly simple, which is just renew a prescription that someone's been in for years. But it's actually almost more than what I would ask if I was seeing someone in person. In person, I'm kind of like, okay, yeah, you seem fine. We'll just renew your prescription, no big deal. Because there's that comfort level when they're in person, right? And so when they're not in person, you just have to do all these extra checks and balances to make sure that you're really doing the right thing. After the seed round funding came from Y Combinator. And for anyone watching that doesn't know what Y Combinator is, it's basically an incubator that takes on a variety of different entrepreneurs in different fields and helps those companies get off the ground. So it's very competitive to get into. So the fact that you guys were in Y Combinator in and of itself is a pretty big achievement. And it's great for networking, amazing hosts of people that are involved in Y Combinator, and I've been lucky enough to sit on some of the presentations on demo day, they're really just super fascinating. And I've actually been an investor in one of the Y Combinator companies a couple of years ago. So after Y Combinator, how did you guys raise the next few rounds of funding, and have you done any big raises since then?
Yeah, we've raised a few rounds since then. I think there probably was a family and friends round in between there. And then Series A was our last one. Once you're in that space, I think the Y Combinator opens the door to these investors that are, Silicon Valley, very familiar with the area. And then even with like going to conferences and meeting these people, it's just intro after intro after intro. And I think our mission truly resonates with what we're doing. So you have to make money. The money is always the bottom line. However, when you put doing good for kids with that, it becomes very attractive.
Yeah, of course. We all want to do good things. And unfortunately, the hard part about entrepreneurship is you got to do good things and you have to make money. Otherwise, you're...
Yeah. And speaking towards that, and like your point before about having a doctor at the C level and making decisions. So you have to, like, this is reality. As much as we'd want to all, own everything as doctors, like we don't have the capital. So it's got to come from somewhere. But also then not only do you want to make sure you're doing right by the patient and that the capital is going the right places, you want to make sure that your doctors are protected so that they can practice the quality of medicine that they want and that they're going to be paid for it adequately. There's so much of what we're losing out of our control in the medical field as doctors and what's being owned by like whoever, big hospital systems, big investors. It's just, we need to be careful as to who's involved in the decision-making process. And that's why even when you find it like, great, you need money and like people are willing to throw you money, you have to be careful about who you take it from too. You want to make sure that they're going to be real partners in this and uphold your mission and your values, especially again, like they're in the medical field taking care of kids. Like we can't compromise on that.
Especially I think with insurance companies, the cost of doing business for a lot of providers and physicians is just so much higher that when you actually eliminate that from the equation, cost of doing business is so down. Like I will say in my private office, like we literally have 2 to 3 people that are fully employed just calling insurances. Like that's it. Like, patient comes in, they wait in the waiting room, we verify their insurance. Like that is like 50%, maybe even more, maybe 67%. Then we have a biller that we pay a percentage to because, they need to go and get the insurance payments that the insurance companies refuse to pay. So it's a whole system that adds astronomical costs to healthcare. And yes, physicians need to be paid adequately. And what's happening in this game is that it's a volume game. So, with ophthalmology specifically, unfortunately, we have really expensive equipment. And so going direct to patient and not taking insurance is a very difficult thing because those procedures and processes can be extremely expensive if you don't have insurance. But it's still something that, people are trying to figure out, like, how do we make things more affordable, and still provide the same level of care. So it's definitely a really important mission. I love the mission of the company. What states are you guys active in now? I mean, I know
So we've
you're in
grown.
29, but
Yeah, we've grown tremendously. So right now we're in 29 states. We're in all the big major ones. It's hard to list off all 29, but like I would say the big ones, New York, Texas, Florida, California, and then I'm like Georgia, Tennessee, Kentucky. It's like a test to see if I can get all these. Pennsylvania. I'm going to stop there because I'm not going to remember, but a lot. Utah.
And is it mainly synchronous care or asynchronous care? So for anyone watching who doesn't know the difference, synchronous means that the pediatrician is going to meet with you face to face. And asynchronous means you're going to collect the data and you're going to send it to the doctor and then they're going to respond. So Dr. Garbi, is it mainly asynchronous, synchronous care, or a combination?
Yeah, we're asynchronous because we ask for all the information to be sent to us, like a video, a photo, the images of the otoscope into the ER. But we are instantaneous real time. So we receive that when a visit is initiated or parents are messaging with us because they can reach us by the 2 modalities. We can also do video calls if needed. And then we get back to them. We guarantee within an hour, usually it's a lot less, 15, 20 minutes, you can hear back from a doctor.
That's amazing. That's really awesome.
Thank you.
All right. So what's next for Blueberry in 2024?
Yeah, so we're 28 states. We're waiting for that 29th. I mean, another thing, if you're in this field, you understand the pain of licensing. That is, I mean, if anyone knows, like, it's like a dagger through the heart. You have to be licensed in the places that your patients are. So 29 states is a lot of legwork. So we're figuring that we've done all that legwork. Now as we've opened up, we want to make sure that we are doing it all as efficiently as possible, optimizing our engineering and the platform that the doctors work in and the parent experience, and then growing. We are already in the space and want to grow partnerships with payers. We feel that's a big opportunity. We've actually shown a reduction for ER usage by 40% in a pilot that we've done with a hospital system. So that's huge ROI for partnership potential. And we have several in line ready to go. We'd love to have more. We're working on that as well. We feel like it's a win-win everywhere around. So like you get the patient back to their medical home. They don't have to go to the ER and cause for cost all around. So reduction in medical healthcare costs, and then appropriate care.
So before we get to the last part of the interview, if you're watching and you find this interesting, go ahead and hit the subscribe button below and share this video with a friend. It really helps out the channel as well as all the people that we interview and the innovative companies that they are starting. So one of my last questions for you is, what are the biggest challenges that you as a company and, as a physician in a startup, what are some of the biggest challenges you face from a company perspective and from a personal perspective?
Yeah, it's a really great question. I think that for my position is always balancing the business and the clinical end. I always say I make the life of my CEO harder. He makes my life pretty easy because thank goodness I have a partner here who can see the value in all of my asks, and I have to make them reasonable. So this has to be in terms of like the pay for physicians, the expectations for them, the timing for them, and then how we enable them to do all the things that we want. So it's a difficult balance in terms of like knowing where the line should be drawn, and like first of all evaluating how I feel about all the asks of that the doctors are making, what I think is reasonable, what I think that we should follow through with as a company, and then how I think it's going to be met by the business end, and ultimately we have to make our bottom line work or we won't survive and be able to pay the doctors.
Yeah, that's a really valid point, because it's not just about managing the patients, it's also about managing your team. And as a company grows, that team becomes really important too, right? Like, not that it wasn't important in the beginning, but when it's 4 people, it's much easier to manage than when it's 100 people. And, you know, people are also invested in your mission, but they also are invested in their own lives, and they need to have a good workspace. They need to have good work-life balance. And
they need to really feel valued. I think that's the biggest key here. So that means ample compensation, ample benefits, and then transparency within the company, that they feel really invested emotionally in what we're doing, and that we're doing it in the way that they believe in.
Yeah, transparency is huge. I feel like when companies really start to go under, it's when people are unaware of what's going on and they're confused by decisions that are being made. And there's just really a poor, really poor communication happening between the executive team and everybody else. So great points. Really, really interesting interview. I'd love to bring you back in about a year if you guys are open to it, to kind of see where the company's at.
Yeah, absolutely. I'd love to do this again.
Okay, awesome. Thank you so much for joining us. Bye, everyone.
Bye.